Bon après-midi, tout le monde et bienvenue. Good afternoon, everybody, and welcome. Speaking this afternoon in the following order are Dr. John Dornan, Interim President and CEO of Horizon Health Network, Dr. France Desrosiers, President and CEO of Vitalité Health Network, the Honorable Dorothy Shephard, Minister of Health, the Honorable Ted Flemming, Minister of Justice and Public Safety and Attorney General, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-paroles aujourd'hui sont dans l'ordre. Le président directeur général par intérim du réseau de santé Horizon, le Dr. John Dornan. La présidente directrice générale du réseau de santé Vitalité, le Dr. France Desrosiers. L'honorable Dorothy Shephard, ministre de la Santé. L'honorable Ted Flemming, ministre de la Justice et de la Sécurité publique et procureur général, et l'honorable Blaine Higgs, Premier ministre de Nouveau-Brunswick. Dr. Dornan.
Thank you very much. Bonjour. Essential employees. In Horizon and in Vitalité, we do not have a buffer of employees. We are at a suboptimal level 365 days of the year. When there's a strike and we move down to essential employees, what we are saying is that we are going what we are barely getting by with and lowering that. You can anticipate the results. We start to see a buildup in the surgeries that we don't do. You start to see an increase in the number of people that wait for vaccinations, people that wait for testings in our community. We start to see a backup of garbage, a backup of dirty trays, and it grows. On the first day of the strike, tolerable. We weren't doing all the surgeries that we had been doing the week before. The second day of the strike becomes less tolerable and it builds. So what we were asked to do was assess this daily, let people know, let the government know when we were broken. And so we did that on a very regular basis. We went from green to yellow to red in some areas, but barely tolerable. As of yesterday, we had canceled 215 surgeries. By today, we've canceled over 240 surgeries. Yesterday, it was 8,100 tests and procedures that we did not do. Today, it was 10,000. We are broken. Yesterday, we felt that we had reached that tripping point to the point where people's health was in jeopardy. And that's not the pain point for us as caregivers. That's the pain point for folks in the community. Our mothers, our brothers, our sisters, our parents, our children. So yesterday, we felt that their lives were at risk. Yesterday, we had 13 cases waiting for emergency surgery. Emergency surgery. This is not stuff that can wait till tomorrow. Had one more ruptured aortic aneurysm or one more severe case come into our facility yesterday, someone would not have received surgery. We never operate with dirty instruments, but we did not have enough to do surgery. So we are broken. We were broken yesterday. We pulled the pin yesterday. We said we need help. We need essential workers to come in. We need more than that. We need people to be at our side. We need folks to help clean our surgical trays, help prepare our rooms for surgery, help clean our patients' rooms for the next patient. At present, we are seeing an unacceptable growth in the people waiting for testing. You know, how do we get ahead of COVID if we don't know who's infected? If they're running around working in our communities and therefore infecting other people. It's a very critical emergency situation. So we have seen the number of essential people in some hospitals different from others. So for example, at the regional hospital, St. John Regional Hospital, we're less able to deal with surgeries that are provincial-wide, such as heart surgery, surgeries for stroke, that we can actually turn around a stroke with a surgical interventional radiology process. We are on the verge of not being able to do that anymore. People will suffer. People in our communities will suffer. So We desperately need some level of mandatory legislation or agreed settlement so that our team comes back. We desperately need you in our hospitals yesterday. Thank you very much.
Merci à tous de prendre le temps de nous écouter cet après-midi. Alors, en tant que Régie régionale de la santé, comme vous le savez, notre mandat est d'offrir des soins et des services de qualité aux patients, et ceci a toujours été notre priorité. Depuis le début de ce conflit de travail, le réseau de santé Vitalité a travaillé avec ses partenaires de manière collaborative afin d'atténuer les impacts négatifs de la grève sur nos opérations et conséquemment sur nos patients et leurs familles. Le réseau de santé Vitalité a tenu le coup le plus longtemps possible, sans compromettre la sécurité des patients, afin de soutenir le processus de négociation entre les parties. Je tiens à souligner l'engagement et le professionnalisme de tous nos travailleurs de la santé. Ils ont démontré et continuent de démontrer leur souci d'offrir des soins et des services à leurs patients pendant la grève. Avec nos partenaires tels que le réseau de santé Horizon et d'autres partenaires, nous avons rencontré quotidiennement le ministère de la Santé pour donner un compte-rendu sur l'impact de la grève sur notre offre de soins aux Néo-Brunswickois et Néo-Brunswickoises. Il faut comprendre que la situation n'est plus tenable. Nous composons avec 70% d'employés, mais nos établissements sont occupés à 100%. Les circonstances deviennent sous-optimales pour la prestation de nos soins. Après 7 jours de débrayage qui affectent le système de santé, il nous apparaît clair que les impacts de la grève sur nos patients commencent à être significatifs et un retour à la normale est nécessaire dans les plus brefs délais. Le réseau de santé Vitalité a dû reporter plus de 300 chirurgies et près de 1000 rendez-vous et procédures de patients depuis le début du conflit de travail. Et on s'entend, nous ne fonctionnions déjà pas à 100%, puisque nous étions en phase d'alerte rouge pour la pandémie. La situation dans nos blocs opératoires est fortement ralentie et particulièrement difficile à notre centre de référence tertiaire, le CHU Dr Georges L. Dumont, qui draine les chirurgies oncologiques pour la majorité du réseau. Des chirurgies urgentes pour des cas de cancer risquent de dépasser la période d'attente jugée acceptable selon les normes. Les défis de fonctionnement de nos établissements sont nombreux. Les repas pour les patients, le nettoyage, la désinfection sont tous au ralenti. Certaines fournitures manquent. Et à tout cela s'ajoutent les grandes inquiétudes en lien avec la gestion de la pandémie COVID et les services qui s'y rattachent, tels que John Dornan vous l'a résumé tantôt. Avec cet arrêté, nous allons travailler d'arrache-pied pour revenir à des horaires normaux, faire le rattrapage nécessaire pour revenir à des opérations relativement normales. Nous sommes toujours en période COVID, il faut s'entendre, mais ma priorité sera toujours les soins aux patients et nos travailleurs de la santé sont pleinement engagés pour aller de l'avant. Merci.
Good afternoon. Bonjour. As you've just heard from the regional health authorities, the ongoing strike has made the situation facing hospitals across our province increasingly precarious. The healthcare system was already strained due to the pandemic, and the situation has gotten worse over the past week. Due to the CUPE strike, COVID-19 assessment centres have been impacted by closures and/or experiencing a significant reduction in capacity. Our patient referrals for testing are on hold. Cleaning services in hospitals are also being affected by the strike, resulting in longer than normal times to prepare rooms for new patients and sanitary levels below COVID-19 protocols. Food service is significantly reduced in all hospitals, jeopardizing the nutritional requirements for patients. In addition, laundry services is an integral component in the management of infection control for delivering patient care for hospitals and nursing homes. Laundry service operations are 60 to 80% below designated levels each day. This is not only impacting our hospitals, but also our nursing homes, as they are responsible for cleaning bedding, uniforms, face cloths, towels, surgical linens, and personal protective equipment for staff, among other items. As we've heard the CEOs of our RHAs explain, I've counted nearly 13,000 hospital procedures and appointments that have been canceled since the strike began. That number represents real people who are not able to get appointments for much-needed physiotherapy or occupational therapy. Children working with speech-language pathologists could experience setbacks on progress made as they wait to resume appointments. Someone waiting for a mammogram or an MRI will have to wait, which could put their health at risk. Simply put, New Brunswick's healthcare system is in serious jeopardy and cannot withstand another weekend at the red alert level. Steps must be taken to ensure that our hospitals are able to operate safely so that we can keep the people of this province healthy and safe. Minister Flemming will now share the details of what those steps will be. Before I finish, though, I want to remind everyone that we truly are in this together. I have heard that there are messages on social media encouraging people not to go back to work, no matter what government does. I want to acknowledge that I understand this is a legal strike. I also believe that our employees would never want their actions to endanger others. While I understand the frustration people are feeling, I want you to think about how you would feel if it was your mother, your father, child, spouse, or friend in a hospital right now. I believe that at heart we all want the best for one another, and I encourage you to follow your heart as you make your decisions. Thank you. Merci.
Good afternoon. Bonjour. Out of concern for the negative impact the strike is putting on the delivery of hospital services and healthcare in our system, the government has found itself in having no alternative but to implement an emergency mandatory order. You have all heard the previous three speakers, and when the situation was placed before me and before Cabinet, which Cabinet being the ultimate decision maker, we found ourselves in a position that we had no choice and could not, in all conscience, not proceed with this unfortunate but necessary intervention. We are doing this to prevent loss of life, lack of treatment, deterioration in health care, and the potential irreparable harm to our healthcare system. You've heard from the experts. It's an emergency. It's a crisis. And it can't be allowed. Under this mandatory order, all employees of the New Brunswick Public Service who work providing services in the regional health authorities, plus supply chains, are designated essential in order to report to work and perform their duties to protect the health and safety of patients. This includes employees who work in the laundry and health supply chain. I want to point out that the mandatory order does not affect any other bargaining units other than healthcare. This is only with respect to health supply chain services. It is only being done to prevent loss of life, deterioration in the care and treatment of our patients, and the necessary intervention that flows from that. The mandatory order comes into effect at 11:59 tonight. Any CUPE member working in the health sector or laundry services will report to their next shift in the usual manner. This action we're taking is serious because the situation is serious. We're doing what is necessary to ensure that our hospitals continue and are able to do the important work necessary to keep New Brunswickers not just healthy and safe, but alive. I stress that, to keep New Brunswickers alive. I also want to stress that this action has nothing to do with labor relations. That process will follow its course. This is about healthcare. It is about the safety of New Brunswickers. This is about patients who are in hospital and need care. It is about New Brunswickers that may find themselves in a hospital needing care, needing testing, needing intervention. What we're doing today, we do to protect the lives and the health of New Brunswickers. Thank you. Merci.
Bonjour. Good afternoon. It is truly unfortunate that we find ourselves here today, but this situation has gone on way too long. We have friends and neighbors that are walking the picket lines, and many don't want to be there, and I don't want them to be there. None of us want them to be there. As the CEOs and the Minister Shephard explained, our healthcare system is close to the breaking point. The pandemic, coupled with the strike, has put too much pressure on our hospitals and the dedicated staff who are trying to keep them going. Immediate action has to be taken to ensure that we are able to keep New Brunswickers safe. La pandémie, combinée à la grève, a mis trop de pression sur nos hôpitaux et sur le personnel dévoué qui travaillent pour assurer leur fonctionnement. Des mesures doivent être prises immédiatement pour assurer la sécurité des gens de New Brunswick. Today, under the current state of emergency, we are issuing a mandatory order and ordering healthcare workers back to work. This is not a step we take lightly. It does not impact the other locals outside of healthcare. That strike will continue. We're not questioning the validity of the legal strike. We are indeed acting in a pandemic under an emergency order to deal directly with the health and safety of all New Brunswickers. And we need to recognize the system is urgently needs to be addressed. We met with CUPE representatives for 9 hours yesterday, and we gave an offer that was agreed to be acceptable. They were going to take that offer back to the bargaining team with the ultimate goal of seeking ratification from the membership. This offer, including a wage adjustment, amounts to 15% over 5 years. And these annual increases are retroactive. Upon agreement, members will receive the retroactive pay owed to them. On average, each employee will receive $7,000 in retroactive pay. In our offer, we are also increasing wages for casual employees to go from 80% to 100% of the applicable job rate at a cost of $8 million to the province. As part of the agreement from last night with the CUPE president, Stephen Drost, we would sit down with actuaries from both sides and the two school-based groups, 1253 and 2745, to look at the state of their pensions and create a path forward towards sustainability. To be clear, it was not a government making decisions on the future of the pensions. It is an independent process. It will be actuaries trained in financial management to ensure that all employees have a safe, sustainable pension. Our goal is that every GNB employee has indeed has access to a pension. Nous voulons nous assurer que tous les employés ont accès à une pension qui est viable. They say they want their members to go back to work, but they are not engaging in meaningful discussion to support all of their members in the future. Today, I had the opportunity to meet with many of the members who are walking in front of the legislature or around the legislature. And I had a very good discussion with many of them saying, we don't know why we're here. We want to be back to work. And I was saying, we want you back to work as well. And you clearly need to understand what you're being offered. Because I believe if the membership has a chance to view the offer and to vote on it, they will recognize it is fair, it is reasonable, and it reflects their best interests as well as the interests of all New Brunswickers. We have accepted and provided the same financial package as the union put forward 1 week ago. The same financial package that they have now changed because they no longer see it good enough. Essentially, the senior CUPE leadership appear to want to hold the government and the people of New Brunswick at ransom. When we say that we're looking out for all employees, I mean it. We are not taking this lightly today, but it is imperative that we recognize the situation that our healthcare system is in and react accordingly. We want all people in our province to be proud of what they do each and every day as we build a New Brunswick and we build a better New Brunswick for the next generation. And we recognize that these people that are on the line right now outside of their normal workplace are our friends and neighbors. They're people that we need to work with, want to work with, and we need their services as we go forward. It takes all of us to move our province, not just who is in government. Nous voulons que les gens de notre province soient fiers de ce qu'ils font et qu'ils soient fiers chaque jour de bâtir de New Brunswick meilleur pour la prochaine génération. Parce que nous avons besoin de tout le monde pour y parvenir, pas seulement le gouvernement. So the horns can blow and the fists can shake, but I don't believe that represents New Brunswickers. We have an open hand to friendship. We have withstood a lot over this past couple of years as we've managed through COVID. And it hasn't been easy. And we're all tired of COVID. And that's why it's no time to take advantage of this situation. It is time to look at what is being presented. And it's time for all members of CUPE to look at the facts on the table and decide for themselves. This is a time that we see real leadership must come into play. I met many of the leaders of the local unions, and I must say I'm very impressed. I'm very impressed with their dedication, the reality of understanding what their employees need, their members, our employees. And I truly believe they do not want to put our healthcare system in jeopardy. They want to see this resolved. I also believe that if they are listened to, and if the members can get the real facts, they will want to return to work as well. I had workers come up to me as I was leaving that said, we support getting back to work. We need to be back to work. And as we discussed what the options were, I said, well, you know, if we put an order together, it reflects the needs in healthcare. That is the emergency we're in. We're in a pandemic. And I even had some say, could we be included in that order? Because they wanted to come back to work. And I said, well, do you know what the details are of the order, of the offer that's on the table? And without exception, none of them could tell me what the details were of the order that was on the table, or of the offer that was on the table. So unfortunately, our hospitals can't wait any longer. It's imperative that we act now. Malheureusement, nos hôpitaux ne peuvent pas attendre plus longtemps la conclusion d'une entente. Il est impératif d'agir maintenant et d'agir rapidement. The new mandatory order allows us to get back to work in our hospitals. It allows us to get our healthcare system back on track, even though we're challenged with the pandemic still. So I'm here today asking sincerely, if you are a CUPE member, read the offer for yourself. We indeed have an offer that is fair to both workers and New Brunswick taxpayers, and was to be recommended to the bargain unit for acceptance. We had an agreement last night, but today CUPE leadership want more. And I don't believe that's everybody. I urge CUPE leadership to take our offer to the membership for a vote. And just to be sure that we're all on the same understanding and we're all voting on the offer that is present, I would suggest that whatever is taken to your membership is signed by myself and Mr. Drost. Before doing anything else, we must, however, address the strain being felt in our healthcare system. If we do nothing, our healthcare system will collapse. It would directly put our health and safety of New Brunswickers at risk. That is not something we can allow to happen. So we take the action seriously. I thank my colleagues for being here today and saying, time is now, we must act. I am looking forward to the membership voting on the offer that is on the table. But until then, we will manage our healthcare system for the best interests of all New Brunswickers. We're asking CUPE members, our employees, our citizens, to come back to work, and let's keep our healthcare system going. In the meantime, the legal strike will continue in other sectors as the schools will remain closed. And that too is unfortunate, because we would like to end all of this. So today it's about healthcare, but look at the offer on the table and judge for yourself. Are we being fair? Do you feel good about what's there? Do you feel good about your employment with the government of New Brunswick? Because we need you as a valued member to help our province continue to survive, thrive, and be ready for the numerous challenges ahead that we must face together. Thank you. Merci.
Merci beaucoup à tout le monde. Thank you to everyone. Nous allons maintenant procéder aux périodes de questions avec les membres de médias. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste pourra poser une question et une question de suivi très rapide. We'll now proceed to question period with members of the media. Each reporter will have one question and a quick follow-up one. You have the right to pose your questions in the official language of your choice. Laura Brown, CTV.
Hi, Mr. Premier. It sounds like it's come down to the emergency order or withdraw pensions. Now, if the situation is so dire, why did you choose one over the other?
I didn't, Laura, choose one over the other. We didn't put anything about addressing pensions other than the evaluation process. And that was done through independent actuaries in order for the members to actually understand what they have to, with them in terms of the two locals, but also to look at the possibility of providing pensions to the thousands of current employees that do not have a pension. That's all that's there. And it was an independent process for an evaluation. So for anyone to suggest that it's an either or is simply not true.
Ms. Brown, do you have a quick
Yeah.
follow-up?
I'm just wondering if you've given this information to the workers that it involves before you, or are they learning this right now with the rest of us?
Well, if they didn't get the actual offer that we presented, and given what my experience was this morning with meeting with the group, as you know, I was out in front of the legislature with the many that were there today, but also those that were walking the streets around in smaller numbers around the ledge. Basically, they didn't understand what was there. So we have posted it, we have put it out there, and so everyone can see it. But, the number one principle is that everyone deserves a pension. And that is not the case today. So when we talk about, is that a fair thing to offer someone? It's like, should a casual make 100% of the wages? Yes, we think so. We changed that. Should every member of the government of New Brunswick be eligible for a pension if they're working for the government of New Brunswick? Yes, we think so. So, the facts on the outline are very clear, and it is simply an assessment process so that the members will all understand what it means, what it is, and it's very, clear on it doesn't impact anyone's current plans, but it does provide an opportunity for future plans. And the actuaries themselves, which I'm talking about the financial professionals, will do the assessment. So it's not us choosing, it's not us negotiating a pension plan, it's basically a process. So that's what's out there right now. So again, I reiterate, for anyone to suggest that there's a choice here that was being made by government, that is not the case.
Thank you, Ms. Brown. Harry Forstall, CBC.
Hello, Premier. Can you hear me?
Yes.
Thank you. Premier, there are two sides to these negotiations, yet, if I understand you correctly, you're saying that CUPE is responsible for this health crisis we find ourselves in now. What responsibility do you and your government shoulder for the inevitability of this crisis? You could see months ago where this was going to wind up. You could see perhaps even longer ago than that, that ultimately it would come down to a situation like this. And yet you persisted. So do you bear any of the responsibility for where we are today?
Well, negotiation is a process, and it's a process that goes back and forth and has been for many months, and one could argue in some cases years. It's a process that's certainly been enhanced over the last several months, all through the summer and this fall. And as you may recall or may not, CUPE's position has been, up until about 3 weeks ago, 5% a year over 4 years, or I'm not talking. That's been their position. That only changed about 3 weeks ago. And so, we can talk about who's responsible for what and what part we share, but that's the reality of the situation. The teams that were negotiating were working right up until about a week ago, and then talks broke off. And when I went back last night, and we served yesterday and met with several of the leadership team, the whole concept, okay, what was on the table financially, what would we agree and not agree to? So we came to an agreement, and they were taking that back to the bargaining team. This were the senior folks that we came to an agreement with. They were taking that back to the bargaining team, and ultimately, with would be the goal of taking it back to the membership, because I think it is time the membership actually got a chance to look at this. So then, Harry, in the middle of a pandemic, upon an agreement that left the room that, yes, we can propose this to our bargaining team, at 4 a.m. this morning, we got, no, we want more money. So, Harry, you tell me who's taken advantage of a situation and who is holding the province at ransom.
Well, is-
because that's where it is right now.
Mr. Forrestal, do you have a follow-up question?
Thank you. Yes, I do. Did you not expect to have a counter offer?
No, I
And
did not.
Should that, and have you responded to that counter offer?
No, I did not expect a counteroffer because we've been going back and forth. To your point,
Yeah.
we've been going back and forth for weeks and months and years, but no movement until the last 3 weeks in relation to the wage mandate. So last
just-
night, when we met for 9 hours yesterday, the plan was that, okay, we have an agreement here, we can take to the bargaining, we can ultimately take this back to the membership, and we can get over this. I went to bed last night, Harry, with every belief that this was settled, every indication. But also in the discussion last night, it had to be clear that we had to react to the health situation. So we identified some of the areas that certainly needed to be addressed in healthcare, as the mandatory order covers. And I said, this has to be done. We are getting, direct communication every day with our CEOs, and they're telling us the time has come to act. So we said last night, we need healthcare workers back to the table, or back to work, sorry. And the idea was, okay, that'll happen. They understood and asked, well, which ones are we talking? Let's be sure. But you know what, Harry, 4 a.m., you get a message that says, no, we don't accept the offer, but no one's coming back to work either. So you could also say, how did we have a situation that basically surrounds a very close group? Sorry, we got interference here.
Thank you. On va procéder avec M. Pascal Rachnog avec Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre. Vous avez dit dans vos réponses il y a quelques minutes que le processus pour établir un nouveau régime de pension serait indépendant. Mais si je me fie au mémo que votre chef de cabinet a dévoilé plus tôt aujourd'hui, selon cette entente-là, chaque parti, le gouvernement et le syndicat, mandaterait des actuaires de négocier. Mais ces actuaires-là négocieraient en suivant le mandat que les gens qui les emploient leur ont donné. Donc, on ne parle pas d'un processus indépendant du tout. Et à partir du 30 juin 2022, ce serait mis entre les mains d'un tierce parti. Donc, pourquoi vous dites que ce serait un processus de négociation indépendant des désirs du syndicat et du gouvernement?
Because if you read the document, and maybe you've had access to it, if you read the document closely, you will see that the whole process is guided by 2 actuaries, one for the union and one for government. And in that situation, then they evaluate and present to the membership the state of the pensions. And then the idea is to say, okay, you guys figure out what is required here to fix this. And if you also read the points in relation to the governance around it, which is what we agreed to last night, it was all about everyone has access to a pension. And no one loses value in any pension. These are all the criteria that we discussed back and forth because we wanted to make sure. And then the plan was that they would take that back to their pension experts and say, well, okay, maybe there's some other qualifier we want to put into it. But the principle was that the actuaries would evaluate, and the process would go through a financial evaluation. So we're not pension experts. We're not going to force it one way or the other. We're just going to say, does a pension, is it sustainable? Is it not sustainable? And how do we fix it? And in the process, we're going to ensure that every employee has access to a pension plan. So it's a really an independent process because it's the actuarial information that would decide whether it's real or not real and present to the members on that analysis.
Merci. Vos questions de suivi?
Oui, ma question de suivi est soit pour le Premier ministre ou pour le ministre de la Justice. C'est par rapport à l'arrêt d'urgence pour forcer un retour de travail pour les employés de la santé. La Cour suprême, en 2015, a tranché assez clairement que si les gouvernements limitent le pouvoir de négociation d'un syndicat, le pouvoir de faire la grève, il doit proposer une voie alternative pour régler les différends. Dans bien des cas, c'est l'arbitrage obligatoire, l'arbitrage exécutoire. Est-ce que vous avez prévu un mécanisme alternatif pour les travailleurs que vous allez forcer à revenir au travail?
You see, your question is approaching this from a labor relations point of view. The mandatory order is not about labor relations. Labor relations are a separate issue. This doesn't affect other aspects of the situation. It doesn't affect other people who are on strike. The driving element of this is health care. It is the intervention under an existing emergency order to prevent the loss of life, the deterioration in health care, the deterioration in treatment of disease, trauma, anything else like that. So your question comes from a labor relations point of view, and this has nothing to do with labor relations. This has to do with safety, health care, preservation of life, prevention of loss of life, and the continuity in treatment and diagnostic for the people of New Brunswick that need it.
Thank you. Natalie Sturgeon, Global TV.
Hi there, can you hear me?
Yes, thank you.
My first question is for the Premier. I'm looking at a comparison between the two offers, and it is identical apart from the section that says including pension concessions. Why have you dug your heels in on this particular issue, the pension? Why not just set it aside and move forward with the offer?
Actually, you know, that is what we did. And I guess I would correct another point, they are not identical. If you look at the financial piece in the years 4 and 5, on the 2% plus an adjustment, you'll see that there's additions there in both years. So we did set the pension aside. That's exactly what we did. And said, we'll put it over here and it'll be evaluated and it'll be done independently and the members will understand exactly what it is. But I think it's important really to point out that this situation on the whole pension thing only affects 2 of the unions. And within one of those unions, there's about 2,500, maybe 3,000 members that are not able to be in a pension, that it would allow them to be in, depending where they end up the actuaries. But if we look at potentially a different format, but that'll be determined by the actuaries. But I also think it's very important to understand is that what we have on the offer financially is a $7,000 rebate, the refund that everyone will see as a result of signing this because of the retroactivity, but also that this reflects with a wage assessment, wage adjustment, and the general increase, 3% a year for 5 years, a 15% increase. So, you know, I think that we really need to put this exactly where it is. This is an extremely good offer for the employees, and recognize that in some cases they are the lowest paid group within GNB. And we are understanding that and moving to correct that. But I think it's very important that we look at what's on the table. And to your point about setting the pensions aside, that's exactly what happened. And there's a process to analyze them to ensure that the members' pension is secure and how it's measured going forward, not by government, but by the financial process. So I just encourage anyone to really look at the information. Thank you.
Ms. Sturgeon, do you have a quick follow-up?
Yes, it's still for the Premier. You joined the CUPE press conference this morning. I'm just wondering why you decided to do that and how you felt when you left.
I felt like I was talking to my friends and neighbors. When I spoke to people on the street, I was so impressed at how cordial they were, how the conversation was so friendly and mature, and I would say, obviously on both sides, that's what it takes to have a good conversation. How sincere they were, and they wanted to be back to work, and how sincere I am that I want them back to work. So when I said to them, you know, I just encourage you to really look at what we've done here, because this is no time for anyone to take advantage of one or another. This is a situation that needs to be fixed. And so I feel very good about what we have put forward. Unfortunately, our employees, the members of CUPE, did not have access to all the information or an explanation. And that is why I said in my address today, that if they vote, we encourage them to vote on the package. When they do, however, they should have a copy of the agreement or of a government proposal, I will say, that is signed by both Mr. Drost and myself, so they know they're getting the real information.
Thank you. Vicky Hogarth, CHCO TV. Ms. Hogarth?
Can you hear me, Bruce?
Yes, thank you.
Oh, thank you. Premier Higgs, are you worried about the long-term effects that mandating people back to work could have on the healthcare system in terms of worker morale and job retention? Is that a risk that could potentially be more damaging than good?
Well, I'll put it this way. You know, every decision is based on kind of what is the biggest decision to be made at this time. And the biggest decision to be made at this time is the health and welfare of all New Brunswickers. And that includes people who are on the line that may be sick or need attention in their hospitals, in our healthcare system. So that is job one. That has been job one. Really, it's been the top priority in New Brunswick or in government for generations, but never more so than during the pandemic. So right now, our biggest concern is to protect the health and welfare of all citizens within our healthcare system that can be served. We obviously will have some tensions in going through this route with the workers themselves, but you know what? From what I heard this morning, and I actually had some say, will we be included in this? And I said, no, it only affects healthcare workers. Well, why can't we be included? I work in this field or that, it's kind of connected to health. So what does that tell me? That tells me that they want to be part of New Brunswick's success story, and they too want to understand why they're there, walking around the legislature, rather than being at their job, doing what they love. We want them back. We need them back. And we will work through some of the, I guess, issues about returning to work when the time comes, but the time should be sooner than later. And we will get through it.
Ms. Hogarth, do you have a follow-up?
Yes, Premier Higgs, about how many workers will be mandated back to work starting tomorrow, and what will happen to a worker who doesn't follow the back to work mandate?
I don't have the information for the actual number of workers. That would be the health authorities who would have a better idea of that. The order will be posted, if not already, it's already been signed. The order will be posted on the web page, and it sets forth a series of non-compliance issues. But I didn't talk about that today intentionally, because I think people are made of a higher way. I don't think people want to have their actions result in someone dying. I don't think people who are out around the legislature protesting, and I must say in the most civil and polite manner that I've ever seen. I've been around labor relations since I was an articling student 45 some years ago, and I've seen a lot of labor. But I have to say, these people were polite, they were considerate, there was no improper behavior, and I think that same type of person is not going to do something to harm their fellow New Brunswickers. If one of those people that were protesting today happened to get hit by a car, I think when they go to the hospital, they want somebody to look after them. I think people understand that, and I think that there is a higher sense of consideration. The golden rule, it was called when I was growing up. And I just didn't talk about it. It's in the order because that's what goes in orders like that. But I can't believe that a disregarding of the law and disregarding of the health, welfare, lives, treatment of fellow New Brunswickers would be done here. So I'm optimistic that law-abiding citizens will do what law-abiding citizens do in a nation of laws.
Thank you. Allison Sampson, CTV. Ms. Sampson? On va maintenant procéder avec Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, est-ce que vous m'entendez?
Oui.
Oh. Ma première question serait pour le ministre Flemming. Monsieur Flemming, je ne pense pas que j'ai entendu une réponse à la dernière question. En fait, qu'est-ce qui va se passer si les travailleurs du système de santé ne retournent pas au travail demain? Je comprends que vous ne voulez pas aborder ça, vous avez vos raisons, mais qu'est-ce qui va se passer?
Well, I have a habit of not answering hypothetical questions in the sense that that's for tomorrow. I am optimistic that we live in a nation of laws, that the rule of law will prevail, and that won't have to do. So I'm not going to say what if, and if he does this, then we'll do that. I intentionally didn't deal with that aspect today because I am optimistic in the character of the people of New Brunswick, be they CUPE members or anything else. And I hope that that doesn't come our way. But if it does, we will deal with that at the time.
Question de suivi, Monsieur Boudreau.
Oui, Monsieur le ministre, il y a une autre question à laquelle vous n'avez pas répondu. C'est, dans le fond, est-ce que vous avez prévu un autre moyen de négocier spécifiquement avec les sections locales du système de santé, oui ou non? Est-ce que l'arbitrage exécutoire est sur la table?
You see, again, you are coming to questions to me. I'm not here to talk about labor relations. There is an emergency in our healthcare system, and Cabinet met and has no alternative but to deal with that emergency. This doesn't affect any striking people who are not involved in healthcare. It doesn't affect labor relations. I'm not negotiating with CUPE. I wasn't in the room, and I wasn't a part of making the offer or anything else like that. My job here is in my capacity as a minister responsible for public safety. I'm not the health, let me finish. I'm not the health minister anymore. My colleague, Minister Shephard, my good friend, has that job now and is doing a tremendous job in my judgment. And I'm pleased and encouraged at the job that she does. But I'm not here, if you want to talk about labor relations or anything else, I'm here to talk about public safety. And the situation in New Brunswick right now, the public is not safe. The patients in hospital are not safe. People who go in an accident or trauma or a heart attack, if they arrive to a hospital, they are not safe. They do not have the capacity to treat them. I am not here to talk about labor relations. I'm not here to talk about arbitration. I'm not here to talk about offers. I'm not here to talk about anything. I'm here to talk about public safety. And if you heard the presentation made by the health authorities that we had today as to what is going in our hospitals, well, I can tell you, I was thinking about the presentation, and when the presentation was over, I could not, in all conscience, not sign the order. That's how dire things are.
Andrew Waugh, Brunswick News.
Thanks, Bruce. Premier, I just want to read this tweet out to you from David Kuhn. The use of the Emergency Measures Act powers to order public sector workers back to work circumvents the democratic process of the legislature. This is unacceptable, and I will be stepping down from the COVID Cabinet Committee as a result of the Premier's unilateral action. Could you comment on that, please?
Well, I probably, it would be best if you talk to Mr. Kuhn. We had to react quickly today, and ultimately it's a cabinet decision. Any decisions that are made come through cabinet at the end of the day, and that's where the final decision is. You know, having gotten a report at 4 a.m. last night that what we believed was going to be accepted was not, and with new demands on the table, then it was obvious the next thing to do was understand where are we right today within our healthcare system, and we certainly got an update in that case, not only here but earlier from the CEOs, and the path forward was clear. Now, would we debate such a path forward given the questions that I've had in the ledge today? Did we think we would be accomplish more by talking more about it in the legislature? Or would we have to move quickly? And I would dare say that what you've heard today and what was required here was leadership from our government that must react to protect the health and safety of citizens. The time for talk was not this morning. The time for action was today. And that is exactly what we have done.
Thank you. Mr. Waugh, do you have a follow-up this afternoon?
I do. Thank you very much, Bruce. So, Premier, this one's also for you. There's 14 people in hospital right now, and our projections are showing that it could drop below 10 as soon as this weekend. You promised that once that happened, you would end the emergency order, which would take away the authority for you to order these workers back to work. If the number drops below 10, will you honor that promise, rescind the back-to-work order, and let the strike resume?
You know, that's an interesting, I guess, as the minister here just talked about hypothetical questions. Yeah, we're all hoping the numbers will go down, and we will continue to work with our health authorities in order to ascertain the situation. You know, right now, we know we got quite a backlog of items, and it would be great to not have COVID as one more thing to worry about. But we'll worry about that situation when it happens, or we'll welcome it when it does, and make the appropriate decision at the time.
Thank you.
Thank you.
Thank you. Allison Sampson, CTV.
Thank you. Sorry about my earlier little snafu with the phone there. My question's for Minister Shephard. You said earlier this week you're reviewing Quebec and Ontario's decisions requiring healthcare workers to be vaccinated due to short staffing. Have you made any further considerations regarding this, and will healthcare workers still have to be vaccinated within 2 weeks?
Thank you for the question. I cannot tell you how many letters I have been receiving from stakeholders asking us to not backtrack. And I want to tell you that we don't want to backtrack, because we know that the safest environment for our patients and our healthcare professionals is to have vaccinated employees doing their jobs. I believe that the 90% of who have received their vaccinations want to co-work with people who are also vaccinated. So at this time, I can't give you an answer. We are still evaluating. We're still looking at what particular options we have to encourage those who are not vaccinated to get vaccinated. But the safest environment for employees to work in, and for patients in hospitals, for everyone who works in our hospital systems, is for everyone to be vaccinated.
Thank you. Ms. Sampson, do you have a quick follow-up?
Yes, so in keeping with that mandate, within 2 weeks, how many people I guess, will not be able to come to work due to not being vaccinated?
I don't have an updated number with me today. Our last count was about 1,200.
Thank you both. Hadil Ibrahim with CBC.
Thank you. Premier Higgs, as Dr. Dornan said, the desperation on the healthcare side can either be fixed with a settlement or this emergency order. Can you walk me through your thought process? Why did the emergency order win out over giving CUPE the wage increase you've previously suggested without touching pensions? What was it about pensions that kind of won over?
If you were listening to my earlier response to that similar question, we actually did put pensions aside. We actually said, you know, this is just a process to evaluate your pension so you understand what it is. So anyone that's saying otherwise, I would suggest just read what we proposed and how an independent process would be part of the evaluation. I appreciate it's an easy scapegoat maybe for CUPE to take. But I would say that affects two locals to review their pensions. So if one wanted to use that argument, maybe you would ask CUPE, why wouldn't they let the other 5 go back to work? And because
if I can rephrase, then why did you choose the order versus continuing to negotiate? Like, what was it about today?
Because what would end? We provided a wage settlement identical to what they proposed a week ago. And we were negotiating back and forth on other items, but the wage package, which consists of a wage adjustment plus 2%, which amounts to actually 15% over 5 years. But today, the decision had to be about hospitals. It had to be about people getting served by our healthcare system. We can't keep going back and forth. And you know, I made a comment before that last night, we all went to bed last night thinking this is over. We'll be able in the morning to announce an end to the strike, overall an end to the strike, and be back to normal over the coming days. And unfortunately, we got a new demand that came in at 4 a.m. A new demand for more wages, higher than what was last week. So ask yourself, who's taken advantage of a healthcare situation? Is it saying, well, this is a time when we can extract more from taxpayers, so we'll do that? And I'm saying this is a time we need to do more for people in our health system that need help. And so it comes to a point that we can keep talking or we can act. And we've chosen to act in the best interest of all New Brunswickers.
Ms. Ibrahim, do you have a quick follow-up?
Yes, Premier Higgs, aside from speaking to people on the sidewalk today, what makes you sure that members don't know what's on the table, as you have stated a few times?
Well, it's a pretty good indication when you walk by several people. I mean, we're meeting them on the sidewalk as we walk along, and asking every one of them, so are you aware of the package that's being offered? And you know, and some would say, well, only what's in the media. Well, you know, I guess it's like, well, that's not right. I mean, I know we have our own issues internally about, you know, communicating and ensuring that everyone understands, and our own caucus understanding what are the issues. And I know it's difficult, and it would be even more difficult with, you know, 20,000 people spread out all over the province. I get all that. But that's why, for me, it was important to stress. I think you really, you know, we need to find a way to communicate. And it wouldn't be for me to go and you know, sit down and with the people or to go out in the middle of the legislative lawn and say, well, can we talk? However, I did suggest that I would welcome the opportunity to have a town hall or a forum and sit down and ask any questions and let's discuss all the issues. But I also made that offer today, and I think you might notice that was the time that one of the CUPE leaders took the mic away from me. I actually asked, let's set up a mic here in the middle and ask any questions you want, and we'll have a good exchange. And I appreciate that might not be the best forum to do so, but I'm not ashamed of what we put on the table. In fact, I'm proud of it in the sense that it's trying a balance of understanding of what the situation we're in today, what is going to be the situation tomorrow, how does it be fair to taxpayers and employees. And that's why it's so important that everyone gets a chance to really understand it.
Thank you both.
Thank you.
On va maintenant procéder avec M. Alex Villeneuve avec Radio-Canada.
Bonjour, M. Higgs. On vient de recevoir un communiqué de l'équipe de Roger Mélenchon qui dit qu'en réponse à l'utilisation ou à l'ordre de l'arrêté d'urgence pour forcer le retour au travail, qu'il quittait le comité COVID. Qu'est-ce que vous réagissez à ça?
Well, I guess it would be the similar reaction to what earlier when I was asked, because Mr. Kuhn has done a similar thing. I'm not surprised. I mean, this is something that required urgent action by cabinet. It wasn't going to be, like other things in the health and safety issues of the statistics around COVID and the issues that we had to do for lockdowns in different areas. It had to be an urgent reaction based on a labor dispute that was not resolved. So we had to act as cabinet and government, which is what cabinet and government do, especially in an emergency situation that requires quick action. So when we found out at 4 a.m. that we were not going to have an agreement, then what do we do when we know that the update is we need to do something? We do what we must, and we react quickly to ensure that our system is protected. And so it's unfortunate. I guess that you could say it's understandable, but given the discussion in the Ledge all this last week, bringing it in for more legislative debate would not necessarily have been the answer, and not reacting quickly was not acceptable.
Merci. Votre question de suivi, M. Villeneuve?
Oui, concernant l'arrêté d'urgence que vous évoquez aujourd'hui pour forcer le retour au travail, est-ce que c'est le même arrêté d'urgence pour la COVID ou est-ce que c'est un nouvel arrêté d'urgence from scratch?
It is an individual, separate, standalone order under the emergency provisions of the Act, but it is not the amending of that. It is a separate order which deals with this particular issue, because although they're similar, there are overlappings as well. There are COVID issues here. So the order posted on the webpage, you can see it. It is laid out specifically for this issue.
Thank you. Merci. Jacques Poitras, CBC. Jacques Poitras.
About that. Minister Flemming, you said in the spring that the emergency order is subject to charter review. So even though you say this isn't about labor relations, you may have to defend this in court relative to that 2015 Supreme Court decision. So how will you justify it legally?
I don't give legal advice on the fly. I know that there's an emergency order, and I know there's an emergency. And if someone could take action against anything that the government has done in the last last 20 months or so with respect to this COVID. These are incredibly unique times. It is a global pandemic, and whether the courts see things a particular way, look, who knows? Jurisprudence is limited on global pandemics. So I guess that's up to people if they want to choose to challenge something. Again, you've heard me say it before, we are a nation of laws, and we are a nation with a constitution, and we are a nation with courts and judges. So that, again, that's anticipatory, and we'll deal with that when, if and when we're faced with it.
Mr. Poitras, follow up?
Minister Shephard, Dr. Desrosiers, or Dr. Dornan, any one of the three, if it took only a week for these non-essential workers being on strike for the system to be broken, why didn't anyone ask for them to be designated as essential long before this?
Thank you for the question, Jacques. It is my understanding that quite some time ago, CUPE was requested to designate these employees, but they declined to do that. So we do have the records that qualify that.
When exactly was that?
If I'm not mistaken, it's several months ago.
Thank you.
Okay, they dispute that timing.
Myriam Lafontaine, CBC. Oh,
Treasury Board's not here, but I'm sure that we can get the timing for you and get it validated.
thank you.
Thank you.
Myriam Lafontaine, CBC.
She's no longer on the call. Can I ask her a question for her? We're from the CBC, so is that all right?
Quick, go ahead.
How
Yes.
long will it take for things to go back to normal with surgeries if workers come back to the hospital midnight?
Thank you for your question. This is why we pulled the pin yesterday, because we knew that if people came back or an order came in effect or there was a negotiated settlement yesterday, it wouldn't happen immediately. We have quite a number of surgical trays that are unclean. They don't become clean overnight. The same thing with respect to beds, same thing with respect to people turning up at testing centers. We have a backlog of tests that need to be done, procedures that need to be done, and we had to work our way through those. So it'll take us a significant amount of time before we get back to where we were before. We felt that even yesterday, we needed people back, we needed our colleagues back yesterday, and even a delay in that, even to tonight, midnight, is going to put us in jeopardy.
And whose idea?
Excuse me, Ms. Ibrahim. Dr. Desrosiers will provide her answer.
Yes, thank you.
Merci. La question est complexe, la réponse n'est pas simple parce qu'on a accumulé un retard chirurgical déjà assez significatif depuis le début de la pandémie. Ce n'est pas seulement le rattrapage du nettoyage des instruments ou de l'environnement qui va nous demander un délai, mais aussi le rattrapage des centaines de chirurgies qui ont été annulées dans la dernière semaine, qui se sont additionnées aux chirurgies qui ont été annulées dans les 20 derniers mois. Alors, on ne peut pas répondre facilement. Ce qu'on peut vous dire, par contre, c'est que les équipes sont déjà prêtes à augmenter leurs heures et à travailler très fort pour rattraper de façon accélérée tous ces retards.
Merci. Follow-up question. Whose idea was it for Dr. Dornan and Dr. Desrosiers to attend this conference?
Nous avons la chance de faire partie d'une province qui, dès qu'elle a reçu l'annonce d'une grève, a déclenché ces mesures d'urgence. Nous avons la chance d'avoir des partenaires en santé, les 2 régies de santé, Ambulance Nouveau-Brunswick, le ministère du Développement social, qui ont travaillé de pair à tous les jours pour s'assurer de demeurer alignés pendant cette crise. Vous avez la chance d'avoir des réseaux de santé qui avaient des plans de grève et des plans de contingence en place, et des travailleurs de la santé qui ont respecté leur plan de grève. C'était pour nous très logique de continuer à faire des rapports réguliers à notre population parce que notre rôle à Dr. Dornan et moi, c'était de bien aviser le ministère de la situation sur le terrain dans nos établissements pendant ce temps très difficile. Est-ce que ça répond à votre question?
Yes, merci.
Thank you, everyone. Merci. Thank you, everyone. Merci. Merci aux membres de médias. Merci à tout le monde pour nous joindre. Voilà la fin de notre mise à jour. That concludes today's update. Thank you everyone for joining us.